Hello and welcome to the Raw Fork podcast. I'm your host, Dr. Marina Buksov, and I'm a functional medicine pharmacist in New York, as well as an integrative health coach and clinical herbalist. I'm pleased to go into season 3 of this podcast and continue to bring on other holistic minded pharmacists, as well as healthcare professionals to the show. I'm constantly inspired by my guests and their stories and love sharing their points of view with you all. Hi, everyone. Welcome to another episode of the Raw Fork podcast. I have with me today Dr. Leah Johnson. She's known in the field as just Dr. Leah, the holistic healer, and she's a clinical cannabis pharmacist. So welcome to the show.
Thank you so much for having me.
Yeah, so why don't you just kind of introduce yourself and tell us a little bit about your background and where you grew up?
Sure thing. So again, I'm Dr. Leah Johnson, or Dr. Leah to my colleagues in the cannabis field. So I grew up in West Hartford, Connecticut. So I'm actually originally from the East Coast.
Ooh.
And I had my basic, after high school, I decided that I took my basic undergrad and I went to Quinnipiac University. After Quinnipiac, I was working in the research and development field for natural herbal, traditional Chinese herbal supplements for about 3 years, and then decided that based on the questions I was getting from most of my patients was, can I take this with this medication? Can I take this liquid tincture with this medication? And I realized that as much as I loved herbals and herbals were a really fascinating part of my field, I really wanted to expand more into medications. So from there, I went on to Massachusetts College of Pharmacy and Health Sciences to get my pharmacy doctorate. And, and then from there, I decided that the East Coast wasn't really my style. So I moved over to California. And that's where I am now in San Jose, the Bay Area. So it's a great place to be, a little bit warmer, definitely.
Yeah, definitely warmer, like much closer to the equator.
Yeah.
Yeah, so that's really cool. What else did you like about California that enticed you to just leave everything behind in the East Coast?
So for me, it's actually less me and more my spouse is he is a computer engineer. So Silicon Valley made more sense for him. And, at that time, I was pretty convinced that I really wanted to be a retail pharmacist, which I have learned the error of my ways over time. But I just was dead set on I was going to be a retail pharmacist. So it didn't matter where I moved to. And, he needed to go to California, and California was nicer than Connecticut. So might as well go. But definitely learned pretty quickly that retail was not really where I could provide the most education and help to my patients. So quickly got out of retail once I realized that.
Yeah, so that's a really interesting story. I don't often hear people doing something before pharmacy and then transitioning into pharmacy. And for you, you actually worked with natural medicine before you did the pharmacy piece of it. So, and you wanted to be a retail pharmacist, which I hardly hear from anyone. So
it was just because the way that it seemed to me was, in retail, your patient's right in front of you. You see them, you can talk to them, you can work with them, you can educate them on their medication. And what you find out is you have no time to do any of that. Your job is to rush, and fill, and go as fast as possible. And honestly, it was the times that the customers said, oh no, I'm not interested in a consultation, I'm all set. That's when you're like, oh, thank heavens, I can move on and still do more work. And that's not why I became a pharmacist to begin with. I became a pharmacist because I found that the biggest issue with most patients is they don't know that the medication they're on are not correct. They don't know that they shouldn't be having side effects, and they shouldn't cover up one medication side effects with another medication. So it was all this information that I had that I wanted to provide to patients and people. And I thought that being in retail, you're right in front of them. So it's a great time to talk to them. But then you find out very quickly you don't have that time to talk to them because you're filling prescriptions. So I learned very quickly that retail, as has its benefits, but for me specifically, it wasn't getting the patient contact and the clinical side that I really wanted to do as a pharmacist. So from there, I ended up moving actually on to clinical consulting, and I was with long-term care facilities, so elderly patients in skilled nursing facilities for about 3 to 4 years. And that was great. I really, really enjoyed it. I really, felt like I was actually being a member of the team, helping correct their medication therapy. But I decided to move slightly away from that as well, because same situation where I wasn't able to help patients the way that I wanted to again, where I would make a recommendation based on incorrectly used medication. And then at the end of the day, it's the prescriber. So if the prescriber said, nope, I don't agree with you. According to my colleagues, this is what we're supposed to do. So this is what we're doing. But it could be, so for example, there are many patients in elderly homes who have combative behavior due to psychological issues such as dementia or Alzheimer's. And the worst thing you want to do is put them on an antipsychotic, because if you don't have psychosis and you put them on an antipsychotic, as you know, as a pharmacist, it just makes things worse. And then it can actually exacerbate the psychosis. So, and make the behavior worse. So that's why I said to myself, it's great that I have the knowledge. It's great that some providers will listen to me and will alter the medication to reduce the meds and get the patients on lower doses that are effective. But I still found way too many situations where people were on incorrect and bad regimens, but the provider refused to change it because they didn't know they literally said, I am not comfortable changing it. This is the medication they came in from the hospital. I don't know what to change it to, so I'm just going to leave it. And so, it was kind of disappointing to say, well, you have, an educator right here to tell you what they should be on. But since you are uncomfortable with the medication in general, you're just not going to touch anything. And it's in my opinion, that's bad practice. If you have somebody who's able to give you the knowledge to improve your patient population and patient outcomes, then you should take it. You shouldn't just say, well, I'm not sure, so I'm not going to do anything. That's the worst thing you can do. So that's one huge reason. And I said to myself, well, you know what? I need to be available for patients then, and for companies, to discuss, all medication of all herbals, all homeopathic, all supplements, naturals, cannabis, everything, and all incorporate it in. So when a patient says, I've been on all these medications, I'm on too many medications, my doctor won't take me off of them, the doctor doesn't really even know what to do with me, help me. That's what and that's what I try to do, for on the patient side, with my cannabis background and my natural herbal background. My focus is really trying to make sure that I review a patient's full medical history, their labs and all their info, and then say, oh, well, yes, we could absolutely treat your anxiety with some herbals and some cannabis, but we also might want to look into having your prescriber decrease and potentially remove you off this one medication that is actually probably causing your anxiety. So, and that's usually what happens is a medication will trigger the anxiety, and then they'll get an anti-anxiety med, which will then cause sleepiness. So they'll get another med to cover that. As you know, it just builds and builds and builds. And it's not what a pharmacist does. I mean, as we both know, pharmacists really should be prescribers, because we really know the best medication regimens for patients based off of their medical ailments and the other medications they're on. So the more that I can help patients do that and get on a better therapy, on less medications, lower doses, that's really what I aim to do, is use whatever holistic or herbal or supplemental therapies to get them a better treatment and a more effective cure for their symptoms.
Yeah. What you're describing is polypharmacy, as we learned back in pharmacy school, but it's just such common practice that you really don't know where to even go. And right now, the biggest thing that insurance companies are implementing to combat this is MTM services. So either the insurance company will pay for it, or they have their own pharmacist or pharmacy technicians that actually are providing the services to the patient, and trying to figure out what we can take off or decrease the dose of, so they could minimize both the cost of the insurance that the insurance has to pay for the medications, as well as, prevent any future tangible or intangible cost of a person landing in a hospital and other medical costs associated with it, which I think is a really good initiative. But the thing that I find kind of mind-boggling is, in general, where does insurance come into the picture, and does it enhance the picture, or does it complicate it even more? Because now there's a doctor, there's a pharmacist, there's an insurance, and there's a patient. And like, how do you see these puzzle pieces interacting? And if I could even challenge you further, how do you see a way to kind of make the system a little more helpful for everyone involved?
So, well, the first thing was, I personally do not believe MTM should be done by an insurance company. I specifically because they have an alternative agenda, which is to get the patient on cheaper meds or, a lower dose, because anything that's cheaper is what they want to do. And cheaper doesn't mean a better patient, a healthier patient. So yeah, they might, carvedilol, for example, might be cheaper than metoprolol, but we all know metoprolol is a much better medication for so many ailments, specifically blood pressure, but like there's many different ailments too, where, out of beta blockers, you're going to choose metoprolol over carvedilol just because it doesn't have the side effect profile that carvedilol does. But that doesn't mean that it's cheaper for the insurance company. So the insurance company might say, well, I know it's only like 50 cents per this prescription versus, 30 cents for this prescription, but think about thousands of patients that take this. Well, look at how much money we're going to save. And I'm very much against that. Even when I actually promote and market and review products, especially cannabis or herbal products, through my the podcast that I do with my partner, I purposely do not affiliate with any of these companies, because at the end of the day, I don't want there to be a reason why I am the one that is recommending this. It's like, no, I recommend it because it's good, not for any other reason. And it's the same thing with this. If you have an insurance company, they have an ulterior motive. They have a reason to try to switch your meds, not necessarily to a better med, but potentially to, whatever's cheaper for them. So, but based on your original question, though, about like, how do we see it in the way that I think the best thing to go is all patients should have a provider and all pharmacists should make sure they're working with providers that are willing to collaborate. There are some physicians that are very, providers, so physicians and PCAs who, will say, oh, I don't believe in cannabis therapy at all, so don't talk to me about it. I don't even know you're using it. And that's wrong. That just means that you have a practitioner that is not seeing what you need as a patient. So what I always recommend to patients is don't go online. That's my number one always first. Don't go online. Don't go and just try to do your own research and read. It's not the best thing. You can get a lot of incorrect information because it can easily be interpreted wrong. So first thing I always say is definitely 100% go to a healthcare professional. Second thing, though, is if you do not trust your healthcare provider that you're currently working with, whether it's a physician, a PA, or NP, you don't trust them, don't go to them anymore. You need to find a better doctor or PA or NP. And there's nothing wrong with that. I mean, people have different views. Just because they're a great provider for one person does not mean they're a great provider for you. I've actually myself changed a few doctors, based on the fact that, I'm a pharmacist, I have my doctorate, I know meds very well. So if I work with a physician or a PA or NP who tries to tell me what I'm doing wrong in my meds and what, the improper supplements, when my entire background is research on these supplements, then, it makes me question their medical advice. And, that's what we are. We're all healthcare providers, but what we do is we're practicing. It's called a medical practice for a reason, because everybody's practicing. Every provider practices. Once, the more they practice, obviously, the more background they have, the more knowledge they have, and the better they are at diagnostics and treatment. But we're all practicing. So when a provider doesn't know about herbal remedies or cannabis remedies or supplement remedies, and they just immediately throw it out the window versus suggesting that you reach out to somebody who does know about it, in my opinion, they're not a fully properly functioning physician or a provider. They should be incorporating everything, not just, you know, what they know and what they believe. If they haven't experienced it or tried it, then to say it's not going to work or not helpful is unfair and misleading to their patients.
Yeah, totally. So, based on what you just said, why is it that you feel so passionate about seeking and incorporating herbal supplements and cannabis therapy in addition to what they're already trained to do, which is allopathic medicine and prescription medications? Why should we look at the everything that's available?
It's because, so my whole thing is, if it works, like, sorry, the funny thing I find interesting is that in the pharmaceutical companies or pharmaceutical way of usage of meds, what you find is anecdotal. If a physician or a NP or PA has used a med, it's like, oh wow, I know this is only supposed to be used for this ailment, but I found great effects when we use it for this ailment. It automatically goes through. However, there is so much anecdotal information as well as actual research on raw herbs and cannabis and other supplements. And the fact that they're not being utilized because they're not from a, really the only difference is from a pharmaceutical company, not from a pharmaceutical company. That's really the only difference. It's, can a pharmaceutical company make money off it or not? And they can't make money off of herbs, and they can't make money easily off of herbs or off of cannabis. So they don't focus on it. And it seems like that's kind of how it's going. But the way I see it is, if there is, why, like, my biggest question is, why be in pain? Why be anxious? Why deal and tolerate with these symptoms if they can be treated? And that's my biggest thing. So, like, for example, yeah, there's absolutely a bunch of anti-anxieties that you can use for anxiety, but they cause side effects. You know, they make you sleepy, they make you a little bit lightheaded, not really focused. Some of them, you know, really are weaker than others. Some you can function on, but why put more chemicals in your body that don't have actual ability to work on specific receptors in your body, where we actually make our own cannabinoids. We make cannabinoids in our system. We have what's called the endocannabinoid system, which is the largest system in the entire body. And it's a system that's already there. So if we already have it there and our body already knows how to utilize it, might as well make sure that we're using, you know, making sure we're using proper regimens and proper herbal therapies to utilize the system properly. I mean, if the system is able, you know, if the CB2 receptor is so effective for, you know, for hormones and external pain and as well as for anxiety, well, why aren't we utilizing it? You know, why are we going to medications that we know will affect other receptors and other systems because they're similar? Why use those when we know that there's actually cannabinoids we can use in our endocannabinoid system, which is made for cannabinoids? And I just feel that we have the knowledge, we have the research, and why not use a better therapy? Why, you know, people, as we've mentioned, especially pain is the biggest thing. People, there's a huge opioid crisis. It's getting bigger and bigger through the day, and people can't get off of them because of how opioids work in the brain. It's the fact that they're upregulating all the receptors in the brain that's making you need more and need more and need more and get tolerant and need more. Where they've shown that even extremely low doses of THC mixed with somebody, you know, given to somebody with who has been now addicted to opioids, is able to actually prevent that euphoria that you get from either the opioid or you get from the cannabis. And it slowly actually allows you to reduce and kind of wean yourself off of the opioid and either stay on the cannabis if needed, if it's chronic pain, or be able to actually fully get off of cannabis and the opioid altogether, because you're getting rid of that pleasure center that you have now triggered by using too many opioids. So it's almost like having a tool in your tool chest that you just say, I'm not going to use it. That would be the most effective tool. And I know that this house would be built so much more effectively if I use that tool, but I'm just not going to use it. I just don't feel like using it. And that, to me, that's my of not utilizing every single type of medication that we have available to us. That's what it seems like to me is, meh, I know it's there, but we're just not going to use it for no good reason except for we just don't want to because it sounds bad.
Yeah, I'm glad you brought that up too. So what I'm hearing from you is that some of the medications are just not as selective for what exactly we're trying to treat or what receptors we're targeting in the physiology. Number two, cannabis works differently and it doesn't cause the same tolerance and euphoria side effects that the strongest medicine for pain we currently have is the opioids and, the classic ones. And even that is not working and you need higher and higher doses. So cannabis would actually decrease the need for that and allow somebody to completely wean off. And then the third thing is that stigma of cannabis is bad because we've always been told so by political leaders and the law enforcement agencies. So now it just feels weird to open up this can of worms for like all the old school people that never learned this. And they have this tool in the toolbox, but they don't even know about this tool because they have never been taught and have never seen it in a different light other than the stigma.
Absolutely. Yeah. And the stigma is really, in my opinion, the worst point of it. I purposely, like, I will correct people. I will only utilize the term cannabis because we have cannabis, we have cannabinoids in our system. And since I really focus on it yes, I'm in California. Yes, there is adult use here. But at the same time, what you find is, well, why are they why adult use? Why are they using it? Are they using it because they just have nothing better to do? Maybe. But in general, like, why are they using it? Like the same reason, why do people drink alcohol? It's usually not because they have nothing better to do. It's usually because, oh, well, they're a little stressed out and it takes the edge off a little bit. So it's the same thing with adult use. So you can call it adult use, but really deep down, you're still utilizing it for a medicinal purpose, to relax a little bit, to decompress a little bit from a tough work day or a tough work week, to get a little bit of that anti-anxiety effect and calm your brain, to help you sleep at night, and so a lot of these adult use patients think they're using it just as using it as adult use. And I won't use the word recreational as well, because it's not a fun game, it's not recreation, it's adult use. So but that's what I've noticed, is that a lot of people don't even realize they're using it for medicinal reasons, because they're like, oh, well, I've always used it to calm me down. Well, there you go. You're using it to calm you down. So the stigma really bothers me. And again, so I won't only use cannabis. I won't use the word recreational. Even when, I'll say, rolled up, crushed up cannabis. I won't say, I don't like the street terms. I won't use joint. I won't use blunt and all that stuff, because again, we don't want to take away the reputability of this amazing medication. And it's already had its, reputation taken away from it. And what really bothers me so much more is that, as you said, it's 100% governmental and legal industries that are preventing us from the use of it, because it was actually used very widely for many, many years, where there's hundreds of old posters of, like, you see a bottle that says cough syrup and it has cannabis in it. It also had chloroform in it, which
Coke.
Yeah, I had cocaine and chloroform. So obviously we need to worry about those types of things. But the only reason why they actually switched away from cannabis, based on the history, is they switched away from it because it was hard to dose. It wasn't like, oh, take one of something. It was, take a little, see how you feel, then take a little more. But, everybody, in general, people get lazy. They don't want to see how it makes them feel. They were like, well, tell me how many. So right around when cannabis stopped being used was when they came out with the individual dose tablets. And then as soon as those came out, then it's like, oh, well, we don't have to say, tell me how you feel, just take this. But to be honest, pharmaceuticals are no better. They really also shouldn't be, we're not all the same person. We don't have the same anatomy. We don't have the same systems. Even twins don't have the same systems, don't have the same response. So why are we trying to prescribe everybody the exact same medicine? We're not all the same. So that's the nice thing also about herbals and cannabis, is it can be tailored specifically to a dose specific for that patient with their specific background and the help they need to treat.
Yeah. So what is your take then on
the cannabis industry right now, and how is that different from the pharmaceutical industry? Because essentially they are also trying to isolate components, CBD, CBG, THC. Like, what is your stance on the whole herb versus all these components?
So what they've shown in research is that anytime you isolate specifically what you're looking for, you're going to actually have a higher chance of causing side effects, because the raw material wasn't made to be restricted in that way. I mean, even opium, like when you take opium and you convert it to opioids, like to Percocet, Norco, into pharmacy.
Yeah, poppy plant is where opioid came from.
Exactly. So if you were,
no plant, it's the seed of the poppy.
Sorry about that. Yeah, I didn't describe that. But the poppy plant, though, in many, many cultures, they still smoke the poppy plant as the poppy plant. They don't do anything. They don't alter it. They don't play with it. And they don't have this ridiculous opioid crisis that we're going through, because the plant is made in a way that's always balanced. Just like human bodies are made to balance their systems, balance the effect, balance what your body does. And I mean, that's what homeostasis is. It's all about balance. And the plants are balanced. Just so the cannabis plant is balanced. The hemp plant, where the CBD comes from, is balanced. Where opium from, the poppy seed plant, that's balanced. But as soon as you start extracting and getting specifics, well, there's a reason why the plants aren't made to have one chemical specifically in one way, because it can't fix it. It can't balance itself back out. So I always explain to a lot of patients too. There are a lot of patients who go, oh, THC, everything's THC, end of story. THC is medicine, done. We don't use anything else. And it's like, CBD is quite effective, and it's very important that we're not just isolating THC. THC can be great for a lot of things and a lot of ailments, but the problem with, if you don't have the CBD, which is the natural balance of the THC, you have those side effects. So it's the same thing when you isolate anything. And I mean, I will always recommend a fuller broad spectrum product to any of my patients, or the companies I work with, over an isolate or distillate, because same thing. Once you narrow down to that specific chemical ingredient you're looking for, well, nothing's protecting your body against the potential negative effects of that ingredient like it would if you were to have the entire plant. So, with the CBD, the biggest thing about CBD is it balances the side effects of THC. So for my patients who say, I'm really anxious, I give them both CBD and THC. The THC to help the brain kind of quiet a little bit, but the CBD for the full body feel, so their heart's not racing, they're not, feeling tense. But at the same time, the CBD prevents the THC from getting those psychoactive properties. So really, you really need it. That's why people always recommend eat the whole fruit, eat the whole vegetable, eat everything that comes with it, because it has all the nutrients in it. Just like the skin has the peels, the skins will have nutrients that you won't get from the raw vegetable or fruit by itself. And it's just, there's so many properties of plants. And again, they're together. It's an all-encompassed entity, and splitting it off only leads to side effects and less effective treatment.
Yeah, absolutely. And same thing also about the cocaine. So the coca plant, it comes from the leaf of the coca, but once you take out that alkaloid, you are potentiating that effect and only focusing on one of the effects of the whole plant and all the synergy that goes on. So Absolutely. If you're just chewing on a leaf, you're feeling like a very, very mild focus, intensifies your focus and alertness, helps you stay awake. But as soon as you do a cocaine, you can get addicted to that and have another epidemic on your hands, which in other countries too.
Absolutely. I mean, people from those indigenous areas have been chewing on the coca leaf forever, especially to help with altitude sickness as well, because it keeps you alert and makes sure that you're not passing out as the oxygen reduces as well in the area. And it's so effective. But again, we're not hearing about this huge cocaine epidemic in those areas. No, because they've always used it. It's balanced with the natural herbs, as you said, the alkaloids, and it's an all-encompassed medication. And that's how everything should be. I mean, with any medication, if you were to take it in its entirety, it's way more effective in causing a lot less side effects. So I'm not against pharmaceuticals, don't get me wrong. I mean, I feel like pharmaceuticals are necessary, in my opinion, for some ailments that just cannot be treated with raw herbs and supplements by themselves. Not saying that they can't be helpful and absolutely benefit. Like, I know lots of people who are on chemo and did okay on chemo. And then the second they started adding CBD and TH therapy, not only did their nausea and vomiting go away, but their cancer itself actually started seeing, reduction in the growth. So it is beneficial altogether, but sometimes I think you do need a slightly little bit of a helping hand from the pharmaceuticals, but you need to know how much and when to say that little bit is enough. And I don't need more than that. And a lot of providers right now don't know that point. They don't know when to say, okay, that's enough. We're going to add this supplement to help the effects, which will help the benefits and not add any more side effects, which would happen if we were to increase your dose. And that's my biggest thing, is that we have all these things. We should be utilizing them together and to fully nourish and heal the body in many different ways, and not just focus on, oh, well, the government says I shouldn't take this, so I'm not going to. I mean, just the government says many things that we don't agree with at times. So why shouldn't this be any different?
Yeah, absolutely. It's like, question the stuff that you've been taught. Even if you've been taught over and over and over again, it could still be wrong. You know, and humans are not infallible. So everybody who's in the government is just as human as us, and they could make mistakes.
Oh, absolutely. And the biggest thing that I always like to explain to patients is the high that people associate with cannabis is a side effect. And not that for some patients, it's a desired side effect, because that high will also knock you out and help you sleep. So that high is good for insomnia. It's good to have that type of high right before bed, so you fall asleep and you sleep and you don't really feel the high because it allows you to sleep. But people say, oh, well, I won't use cannabis as a medication because, it will get me high. And that's what we're here also to do as a cannabis pharmacist. I'm here to explain you're not supposed to get high. I mean, if your goal is not sleep and to knock you out, that's not the goal. The goal is to your ailments, to use the lowest, most effective dose to help you treat your ailments, without any of those side effects. So anxiety, I mean, most people have anxiety during the day. If you're going to, nobody wants to be high all day long, to get around that anxiety. They want to, be able to function. So, and that's one huge thing is, I mean, a lot of people are like, oh, well, I'm going to get high. It's like, nope, you're not going to get high. That's not the goal. The goal is, if you're in pain, the goal is to alleviate your pain. If you're anxious, the goal is to alleviate your anxiety. I mean, that's the goal. And if the high is achieved, then we slowly bring down the THC and slowly increase the CBD a little bit to balance it out a little bit better. So, and that's why you should always work with a clinical cannabis practitioner. So of any kind, just anybody who knows cannabis, knows how to use it properly, and knows how, the proper dosing, how to alter it if a patient's having some negative side effects. It's just all really important to make sure you're connecting with the right person, and you should always trust the medical professional you're working with. And if you're not, you should always go find a different one, because you should always trust the people giving you medical advice.
Yeah, absolutely. So I know you mentioned before about a person using cannabis, quote unquote, recreationally, and you don't like that term. So what would be the difference between working with a provider versus like self-medicating and, just smoking it, like the way that people have been doing to, either do it recreationally to get the high as teenagers or now using it to self-medicate for anxiety and insomnia or pain?
So I think the biggest difference is there's a lot of bad advice out there. There's also a lot of bad and not to be harmful. Like people are always just trying to help, but oddly enough, it's the people trying to help that are not part of the medical professional side that actually cause the most harm. And that's why I always recommend, even if oh, my neighbor down the street that I'm close with said I should try this. Oh, my brother-in-law said I should try this. Oh, my best friend from high school said I should try this. That's great. And I'm not saying you shouldn't, but when you go to dosing, you really need to work with a healthcare professional that knows cannabis, or knows natural herbs if you're using those instead of cannabis. And the reason is because I've seen this a couple times where a brand new naive patient has no idea what dose to use. They say, oh, well, I have anxiety. I take, this medication as needed for it. Can I take this product? And I've seen responses of, oh, absolutely. I was on, 7 tabs a day of, that anti-anxiety and I am, and I am on this dose of it. And the problem is the advisor, the person who's giving the advice, is a heavy anxiety, pharmaceutical anxiety user. So their brain chemistry is not the same as somebody who has anxiety who barely uses their anti-anxiety. So if you were to give that naive new patient that dose of the person who had such the high use, you're most likely going to cause them to either get high or to just get a lot of side effects from the medication. And sadly, all that causes is them to never use it again. And that's what we want to prevent. We don't want to scare away people. And that's what happens a lot is, oh, well, they said if I smoke, marijuana, then I will get better. So I go and I buy it from, the kid down the street selling it to the other kids down the street. And then I'm bringing it home and then I'm smoking it. And then I get completely sedated and, can't function. So I'm never going to do it again. And that's what we want to prevent. I mean, it's a great medication and we're scaring people away by not properly teaching them how to use it. So for that brand new naive person, I probably would have put her on a full spectrum CBD. So it's mostly CBD with only like 0.3% THC, just enough to, get the brain chemistry to work, but not enough to cause that high. And she probably would have stayed on it. But with a recommendation that is for such a high use for somebody who really doesn't use that much medication, you're just misdosing them. And that's why, I mean, let's put it this way. You don't go to your neighbor down the street. You don't go to your brother-in-law. You don't go to your best friend from back in the day and ask them how many pills of your high blood pressure medication you should take. So why should you do the same with your cannabis medication or your herbal supplement medication? It doesn't make any sense. It's if you don't trust them to tell you how to take your actual prescription medication, then you shouldn't trust anybody besides a professional healthcare advisor to teach you how to take your cannabis medication as well.
Well, I can't tell you how many times my patients would advise each other in front of me when one of them posed me a question. Some like 3 other people would step in and start to, convey their advice instead. So that's for sure. It happens. And what we want is for that trust and the expertise to step in so that you can cut out the legwork of trying things that don't work or maybe even harmful.
Exactly.
So can you also talk a little bit to the side effect that I hear a lot too, because of the psychoactive effect of both CBD and THC, but more so the THC, of the paranoia side effect? Like, does that have to do with the plant species or with, the genetics or of the person that is consuming it? Why is that an issue for some people?
So, with with both CBD and THC, they both have paradoxical reactions. So, unlike regular pharmaceuticals, and this is actually how the plant protects itself and protects the people who use it. So the nice thing about cannabis is it's extremely safe. And that's, I actually read a great statistic one time that you need to inhale 1.3 tons, I believe. Oh, no, sorry, yes, it was, I think it was 1.3 tons of cannabis within 15 minutes to die from. And if anybody is able to ingest that much cannabis in that short a period of time, I would be impressed, because that is a lot to go through. And such a short period of time. I physically don't think it's possible. Either way, so it's a very safe plant, but like I said, it's safe because of its paradoxical reactions. So originally, most people actually incorrectly dose themselves with THC for anxiety without that CBD, because they're like, oh, well, I'm anxious, so I'm going to take this. Well, I'm still anxious, I'm going to take a little more. Well, I'm still anxious, I'm going to take a little bit more. The problem with THC is as soon as it hits its peak, it starts doing the opposite. So instead of actually treating your anxiety, if you go too high, you're actually causing anxiety. And the same thing happens with CBD. So any effect that either of the cannabinoids have separately, they'll have the opposite effect if you overdose on it. So like I said, so THC originally is supposed to be really effective for insomnia. It really helps you with your sleep. But if you overdo the THC, you're actually going to have a lot of insomnia problems. And then it's the same thing with anxiety with THC. So that's why you really need both, because the combination of both together prevents that paradoxical reaction. I mean, it still exists, but what happens is it kind of curbs those side effects. So, and also allows you, with the utilization of both, you actually can also use less of either cannabinoid as well. So, I mean, right now, Epidiolex that's being used for seizure patients, the dose is extremely high for CBD. And due to that, it's actually causing some side effects, which they figured out that if they reduce the dose of Epidiolex, they actually aren't seeing those side effects. So the way to reduce the dose of either CBD or THC, but keep it as effective, is actually to add the opposite cannabinoid to keep that nice, balance, that nice homeostasis. So you really need, it does cause that. That's a lot of times because people are using too much of it. I have a lot of patients who have been THC users their entire life. Their flower, which is like the raw bud users, and all of them are, and if you look at the percentages, most of the percentage of what they inhale actually has almost no CBD in it. So, when I have educated them on, I keep upping my dose, it's not really helping me. I think it's making it worse. I'll say, well, add a little bit of CBD. Let's see what happens. So they add a little bit of CBD and they're like, oh, okay, that helped a little bit. So I'm like, okay, well, now reduce a little bit of your THC and add more CBD. And they'll do that. But then I'll do it the opposite way too. There are people who are only on CBD and they're like, well, I think my anxiety seems to be getting, a little bit better, but like my mind is still racing. And then I'll say, you really need a little bit of that THC to help with that brain effect. So it's the paranoia really comes from the overuse. And that's why we want to make sure with patients are on proper dosing so that they don't have that overuse. They don't have that, that whole feeling of like being high, or getting paranoid, because that's the paradoxical reaction is THC starts helping you with your paranoia and anxiety, but the second you take too much, well, now it's triggering your paranoia and anxiety.
So do we have any hypotheses about why people are having the paradoxical reactions? Is it certain people with certain genetic polymorphisms and how the enzymes are converting the THC, or is it just the saturation of the THC receptors? Like, is there any research indicating that?
So what they have shown is, so in general, the cannabinoids in general have these reactions. They just have these abilities to go again, and which also, in some ways also helps you. So like, for example, you can't, if you were trying to achieve the high, for insomnia or whatever, and if you kept going, you're going to hit a point where you're not going to get more. You're either going to be knocked out or you're going to kind of stay at that level because it's not going to let you go more. And that's how it protects itself. So it's just, but it is very much so on, the cannabinoids binding to the receptors, and and then when the receptors do get saturated, we do have enzymes in our system to break down these properties anyway, naturally, but because we're ingesting them, we do have the potential to saturate. The nice thing though is that once the receptor is saturated, it actually will send signals back from the brain, from those areas of the body back to the brain to say, hey, we're good. We don't need this anymore. And by doing that, it actually down-regulates the receptors you have to be able to trigger. And that's what keeps you safe. So it's a really, it does exist. But if you work with a provider who works with cannabis, you can make sure to get around these reactions and make sure that to not trigger them.
Yeah. And can you also just mention the Epidiolex? So was it the liver reactions that people were having? And was it age related, or it was just affecting everyone?
They were seeing it from any age range. They were just seeing that to be able to control the seizure profile properly, they had to use such high doses of the CBD. And since it has no THC in it, you were unable to bypass, to pretty much, if like, for example, if you were to combine, and I say this, but again, I don't know firsthand because, Marinol is synthetic THC, it's not natural THC. So that always does play a part. But if you were to let's say add a slight bit of Marinol to each one of these patients taking Epidiolex, a percentage of Epidiolex they can reduce to still get that same seizure threshold without, increase this seizure threshold so you're not getting seizures, while at the same time being able to lower the dose so you're not triggering the liver reactions. So it's really, they have seen it they have said, they're able to control it when they reduce the dose. But then again, with people with severe epilepsy, you always run the risk of reducing the dose. You might trigger the threshold again.
Yeah, well, this was such a fascinating conversation, and we're running very short on time, but I just have one question. If you could quickly kind of walk us through the recommendations that you would usually be the best case scenario for your patients of how to combine those synergistic effects of the cannabinoids, like which product forms, ingestion or inhaling, like what would be your general recommendations that you usually start off with? And also, just quickly walk us through the plant species, like hemp versus sativa, and, how you would take those components and kind of create the blend.
Absolutely. So the funny thing is I actually never give a cookie cutter because every patient is different, and I do see them and treat them as different. It always depends on the past medical history, their meds, what other ailments they have. But like, for example, if somebody were to come to me who is a cannabis naive user, has never used cannabis before, and they say, oh, well, I have severe chronic pain. Well, usually the rule of thumb is start with a 1-to-1 CBD THC ratio, and, see how it goes. You can do a little bit more THC with that one because chronic pain, you do need it. It's usually chronic neuropathic pain. So it's not really that your body's in pain. It's that your brain is telling your body that it's in pain. So we need to fix those receptors that are improperly sending that message. So you really do need THC as well as the CBD for the chronic pain and specifically the neuropathic pain. So I would start them on a 1-to-1. I would start them on a very low dose, usually about 20 milligrams of CBD, is usually where I would start depending on the ailment. If I was doing a 1-to-1, I would usually start them on slightly less of that. So probably I'd probably start them on, like I said, a 1-to-1, but a really low dose of both. I think would start them probably about, like I said, it all depends on the patient. But usually around the 2 milligrams, if not lower, of the THC and the CBD together. See how that affects them, especially for cannabis naive patients. And then, every couple days I would up it, I might double the dose, see how that affects them. But it's a thing that you should be working directly, consistently with your practitioner, caregiver, for, not separately. So that's one thing. For anxiety, I would do much higher CBD than THC since the body effect is so much heavier than the brain effect usually. So I would do usually higher CBD, like a 20-to-1 ratio. That way it allows the patient to function during the day. If it's somebody who, if we're using something like a maintenance medication as opposed to a symptomatic medication, I would probably put somebody on a edible and make sure that they're taking an edible every single day at the same time. And, depending on how long the edible lasts in their system, I might say, once to twice a day, depending on that patient situation. If it is if it's insomnia, I usually go straight to THC and I don't use the CBD. I use the CBD in the morning kind of to keep the brain function kind of steady throughout the day. And then the THC at night to kind of help you go to sleep, knock you out. Or CBDN, which is kind of when the raw flower actually starts oxidizing. It releases a lot of CBN. And CBN is actually really effective for insomnia as well. So if I were going to mix them, I would put the CBN specifically with the THC or the THC by itself. So I'll do that for people who have insomnia. So really, again, it all just depends on the patient. I usually do inhalables with people who either need immediately fast reactions, or people who are not cannabis naive users, or people who are cigarette or vape smokers already, because that way it's easy for them. They know the method. If a patient is not a smoker and does not want to do any sort of inhaling, I would usually start them off for symptomatic treatment with either an oil or a tincture. It depends on the patient. Tinctures have the alcohol base, where oils are the oil base. Tinctures are really effective, and they actually work slightly faster than oils, but they also have alcohol in them. So if anybody can't have alcohol anymore, or they just don't want alcohol in the system, or if it's for a child, I would never, ever, ever recommend the tincture, because you always want to make sure that that's being used by somebody who can have alcohol and who doesn't get bothered by it. And then you've got the oil. The oil takes a little longer to kick in, only about 15 minutes more. Can be used by anybody, has no alcohol in it. It does have an oil taste because it's an oil. So some people kind of find that taste to be a little bit funny, even though the oil is very, very thin. But if they don't like that taste and they have no problem with alcohol, then I would tell them to go with the tincture. Topicals are great. I'm a big fan of topicals. At this point, there has been no studies to really show that intradermals work. And for those that don't know, intradermals are when you apply it to the skin, but it doesn't work on that specific area. It works on systemically on the whole body. So it has to get absorbed in. So that means that the THC has to get absorbed from the skin into the bloodstream and then go around the whole body. So
transdermal is another. Yeah,
transdermal. So intradermal, transdermal, and what they found is there hasn't been great studies that show this is effective. Topical, absolutely. Don't get me wrong. Topical is amazing. I have a couple topical products that are just fabulous, that are kind of like an icy hot that actually works properly. So it's really cool. It actually turns your body hot in one place and cold in another place, depending on what your body needs in that area. So it's pretty fascinating because it has natural essential oils in it too. Essential oils are great. So yeah, all in all, it depends really heavily on the patient. Most practitioners would say 1-to-1 for chronic pain, heavy CBD, low THC for anxiety, heavy THC, low CBD for insomnia. But honestly, it just depends on the patient, depends on their past medical history, depends on their past usage, and it depends on what type of form they're able to ingest and what form that works best for them for what they're looking for.
Well, thank you so much for that, densely packed mini lesson that you walked us through there. Now, I just brought me to one final question. Is there a risk of addiction with cannabis? And is there any patient population that should not be on it?
So from the studies so far, you can't get addicted to it per se. You can decide you want to keep using it because it works so well. And you're like, oh, I like how I feel better while using it. So, only addictive in the way of saying, oh, well, this, migraine medication doesn't give me migraine, takes away my migraine. So of course I'm going to keep using it. It's the same kind of concept. But like I said, it's a very, very, very safe plant, and very much so made sure to, based on its components, it's able to balance itself out. So when it comes to side effects, I would just say, my favorite quote from my toxicology professor is the dose makes the poison. So, higher dose, higher chance of it of having a negative side effect. But in general, no, it's a very, very safe medication. There are people that shouldn't use it though. The number one ailment that they found that shouldn't use this is patients with bipolar. And that's just as of right now. They haven't had enough. Based on the research, they've shown that taking CBD or THC or a combination has been shown to trigger the manic side if they're in the depressive side. So it does over trigger the psychosis. So we definitely want to make, so I always recommend for bipolar patients not to use it. They've actually shown that for schizophrenics, it somehow doesn't trigger schizophrenics reaction. So that's great. But it doesn't treat them either. It more just kind of keeps them a little less agitated. So it's really good if they're like aggressive or agitated. It helps with that. The other people that shouldn't use it, I mean, obviously at this point in time, based on no research, we cannot recommend pregnancy or lactation because we just should never recommend it anyway, because really, you know, when you're pregnant, you shouldn't be on anything. You should just be taking care of yourself, having nice, natural, healthy foods and taking care of the baby. So, so I can't recommend it, of course, in that patient, you know, area because of that. And, also, there is a side effect. People think that it's completely side effectless, and that's not true. You have your basic side effects, but there is a severe one, which is the hyperemesis disorder. And it doesn't happen to everybody, but it does. It's actually a very small population, but it happens for patients. And usually you see it after about 6 to 8 years of cannabis use. You'll start getting it where you actually, by taking the cannabis, you actually start vomiting excessively. And the way to really know if you have this is the intense desire to take a hot shower. And it has to be like a very hot shower. And it does, again, it's the percentage of patients this happens to is very insignificant, but it exists. And it's always something to mention because it's not for new users that get this. It's really for chronic users that have, you know, been on the cannabis medication for years, and out of nowhere, it can cause this reaction. So I always mention to patients to like look out for it, you know, and again, to always use the lowest effective dose. There's you don't get extra benefit by taking more of a dose. So might as well take exactly what you need to get your ailment your symptoms to be relieved, and then leave it at that.
Yeah, well, that's certainly a paradoxical effect. Something that should usually take care of your nausea gives you that nausea.
Yeah.
So, but you mentioned before that you could potentially taper off once you kind of got your symptom management and your pain sensors under control. That's an option too, to just taper off the cannabis.
Yeah, I mean, and this is not just cannabis. This is, you know, as a pharmacist, I recommend this for all meds, all supplements, everything. Why be on something if you don't need it? I mean, your body, the great thing about utilizing cannabis and raw herbs, you know, that have all the properties of the full herb is the fact is they work with your body and they actually go into like repair, but they're there to teach your body in a way how to function properly, how to function without them. They're there just as kind of like a crutch, just to help you out. So really, if you're feeling, you know what, I haven't had any pain in months, really, I've been feeling pretty good, then talk to your cannabis clinician and say, hey, I've been feeling pretty great. You know, I haven't had any pain. So then, you know, the clinician will slowly wean you down and see if we can keep that same level of control with a lower dose. And, you know, and I have patients who have had the opposite, where they've used for so long that their dosage really is not effective. And as much as I hate to do this, I usually recommend to them, you know, you really need they call it a washout period. And I usually recommended it during like, you know, 2 days, maybe when you're not going out and about, where like you're home and it's quiet. And, you know, that way you can like, you know, you start getting a headache, you can do something else about it, but at least you're not in public. So, or at work. And then usually I'll say for 2 days, you know, no THC, no CBD, completely wash yourself out. And then usually when they start up again, 48 hours is effective. 72 is usually the recommended if possible. And then after that 72 hours, just, you know, when you start again, you start at a much lower dose and see how that works for you. And you only titrate up until you need it. But once you see that effect again, you stop there. Mm-hmm. And then that way it prevents you from going into high use of cannabis.
Yeah, I also just used the example of food. Like, we all need to eat every day, but we don't necessarily, even if broccoli is healthy, we don't have to have broccoli every day. We can, you know, diversify with other cruciferous veggies and other brassica family plants and other greens, and get different types of plant chemicals that are there, and that will give your body the chemistry that it needs. But you do have to eat, but you don't have to always eat the same stuff. So same thing
Exactly.
with using plants and supplements.
Yeah, you should always like move the, try different things, move it around. Like, I was very anti CBD for a very long time, and I also thought it was fake and placebo. And then we heard about all that mess that went on with the vitamin E oil in the inhaler, and so it just and the vaporizers. So it's just, the biggest take home is trust your clinician, trust your provider, and trust your product. You need to be able to trust both your provider who's giving you cannabis information and the product you're using. And if your provider should know a reputable products to use. And if they don't, ask, see if they know somebody who does, because the last thing you want to do is take somebody else's advice on what medication and what dosage would be the best for you as an individual.
Yeah, I'd love to hear some resources that you can provide for the listeners. First of all, where you got trained, because you seem super knowledgeable, and where both pharmacists and patients can go look up different providers.
So with providers, I'm not the best for that one, so I'll be honest. But when it comes to research, I always recommend for pharmacists, at least, if you're interested in being a part of the cannabis world, really, I would say, or field, I would say definitely join or at least look into the International Society of Cannabis Pharmacists. There is an entire society for pharmacists in cannabis. So, if you're a pharmacist and you're interested, I would definitely say this is the time. It's now. This is the jump off point. It's not the start, but it's definitely the platform point where if you want to be in this field, if you want to be in cannabis, if you want to help patients with cannabis education and cannabis therapeutics, this is when to start. It's to start now, because we are the breaking front of this field, and it's one of the few fields that has more pharmacists in it than any other provider. So besides possibly nurses. But nurses and pharmacists are leading this field right now. So that's so great. And, I always encourage pharmacists, join the International Society of Cannabis Pharmacists. They do have, so that was my first training program. It's their Clinical Cannabis Pharmacist program. It is a 3-day virtual course where it's like you're actually, for us, it was remote because of COVID, but and everybody else, though, in future years, they're going to have it at their annual conference, which is a 3-day. It's a 3-day course where you have presentations by other cannabis practitioners that educate you, tell you how they use it, go over different ailments, the side effects, endocannabinoid system, and then you actually sit for an examination, just like your Netflix. For patients and for pharmacists and for patients or any other clinician practitioner, I would recommend the Medical Cannabis Mentor program. That was the one I just took, and I really loved it. It really goes into a great background. It goes over dosing, it goes over side effects, it goes over different patient populations, and then just the different focuses. It also has quizzes all throughout the course. And at the end of it, you do get a certification for being a medical cannabis mentor. Lastly, and if you're really gung-ho and this is the right career for you, and you just love cannabis, like you just think it's the best medication ever, like I do, I would recommend applying for to get your master's through the Maryland School of Pharmacy. I believe it's through the University of Maryland School of Pharmacy. They have a master's of science in cannabis therapeutics. So it's a 2-year program. You can do it at home while you work. So it's like a night school. And twice a year you have to fly to Maryland for those 2 years, but that's it. So, and then that way you actually get your master's. So anybody who is a practitioner who is really interested and definitely knows this is the field for them, like I do, I'd say just go all the way, get your master's. And then that way, once the field starts getting very saturated, at least you have a leg to stand on and you can set yourself apart. A lot of people have a lot of information. A lot of people have had a lot of guidance, but I have my master's, so it really does set you apart to show that you have the knowledge, but you also have the background.
Yeah, I love that. I saw that program actually. It looked super interesting.
Yeah, I actually am in the process. So hopefully, fingers crossed, 2021, I will be in the fall semester and I will graduate in spring of 2023, I think.
Yeah.
Yeah.
Yeah, I saw them taking applications for the new class. So cool. Well, seriously, like you gave us so much information. Thank you so much. But do you have just one more minute for a super rapid fire question?
Sure, go for it. Let's do it.
Number one, what's your number one advice for people to start feeling better right now?
Right now, first figure out if you trust your practitioner, the person, your provider. Do you trust them? Nope. Find a new provider. Step one, find a new provider. And if you really believe in cannabis therapy or you're really interested about it, make sure that your new provider knows about cannabis or at least works with somebody who does know about cannabis.
Okay, number two, what is your favorite hobby?
Oh, okay. Wow. So my favorite hobby, and it's not talking as much as it seems like it is. My favorite hobby is actually dancing. I was a dancer. I was a dancer for many years in high school. So I did jazz, tap, ballet, point, hip hop, modern, a little bit of ballroom. So my favorite hobby is definitely dance.
High five, girlfriend. All right. And finally, what's your favorite beverage?
Ooh, okay. I was talking about regular or alcoholic because I don't know about regular. There's just too many options.
Choose two.
All right. Well, I will say there is a new product that I have tried that I'm super obsessed with. It's actually a cannabis medication. It is, you can get it in 1-to-1, 20-to-1, whatever. It's THC dominant. But it is so cool. It is a cannabis wine. It's like a can of wine. So it comes in a regular 750 bottle. The whole bottle, the entire bottle is only 80 calories. Sorry, I can't speak. 80 calories for an entire 750 ml bottle. No alcohol at all. So if you are, if you were a past alcoholic or you don't touch alcohol, you can absolutely drink this. It is delicious and it's great. And it has, so like, that's become like my new favorite drink. In general, I would have to say probably for non-alcoholic, well, that wasn't alcoholic, but for day to day, I'd say iced tea. I like iced tea.
Good choices. Wow, you have to also give me the product name for the show notes.
Yeah, definitely. I'll send you a message. It is so good. It's from a company called Viv and Oak, VIV and Oak. And they're amazing. The product is great. It's really effective, and the flavor is just awesome. So I've kind of gotten away from alcohol. I don't know if it's age or what, but just with time, I've just kind of been like, alcohol's good. I might have a drink like once a month, maybe a couple a month. But with this, I really love it because it allows me to like have a glass of wine while other people are drinking, but it has no alcohol in it. So that way I don't have to worry. And then if I want to stay functional, I'll just do the CBD heavy one. And it's pretty much just like I'm just treating my anxiety while other people are, enjoying their wine.
Yeah, awesome. So lastly, please tell everyone, Dr. Leah, how they can reach out to you and get to know more about you.
Sure thing. So right now, my website's still is under construction because that seems the story of my life. So right now, the best place to reach me is I have a private group on Facebook, and it's called Alchemist Consulting. And I'd love to have anybody who's interested. I like to post a lot of things on there about different treatments, new articles that have come out with showing different usage. For example, I just recently posted that there's been a new study showing that cannabis can actually, help to prevent dementia, which was a huge article. I was like really excited about that. So that's one location. You can also reach me through email at dr.leahrj@gmail.com. So Dr. Leah RJ@gmail.com. You could also reach me by cell. You can give me a text or a call at 408-418-8802. Again, that's 408-818. Let's try it again. 408-418-8802.
Okay, well, awesome. Thank you so much again for this episode. I had a blast, and I'm sure it's going to be just a wealth of knowledge for anyone tuning in. So,
Thank you so much.
let's definitely keep in touch, and I'll include all that information in the show notes.
Absolutely. Thank you so much for having me. It's been awesome.
All right. Have a great day. Bye-bye.
Bye.
Thanks for tuning in to another episode of the Raw Fork podcast, and I truly hope that you enjoyed it and learned something from it. If you did enjoy it, please don't hesitate to leave us a 5-star rating and a short, sweet review so that other listeners can find us across podcast platforms. To get in touch with me, you can go to rawfork.com or email me directly at marina@rawfork.com. Thank you, and I hope to see you back here next week.